As you can see, we have many speakers today in only an hour, so I'll make my opening remarks as brief as possible. This event comes out of two different contexts. The first in summer 2019, when news headlines were inundated with stories of migrant caravans and the inhumane situations on the US-Mexico border. Some of us at UBC were stricken on one hand by the complete lack of attention to the US imperial histories of dirty wars, neoliberalism, and drug laws that helped create the situation. And on the other hand, how many media journalists in Canada seem to ignore the situation for precarious migrants here in BC, or worse, seem to use stories of caged children to prop up the imagined exceptionalism of Canadian immigration law. Dr. Yidang Trung and I won a small grant to begin conversations with local organizers in Vancouver to learn more about these issues, with the aim of having a public forum such as this. The second important context for this roundtable was exactly a year ago in March 2020, when we had to cancel the first iteration of this roundtable due to the coronavirus. And at that time, nobody had yet heard of this thing called Zoom. At the same time, we saw similar things happening in the media. During the crisis, we began to see the same erasure of precarious migrants in BC, who in many situations, as with Filipina nurses, were the hardest hit by the virus and the most vulnerable to the virus and to the government mandated lockdowns that followed. With the help of Dr. Pilar Riaño Alcala and Dr. JP Katungal and GRSJ, Yidang and I regrouped with these organizers once again to bring this dialogue here to you today. So it is with great joy and relief that I can finally introduce these wonderful thinkers and organizers to you now. Our first participant is Byron Cruz. Byron arrived in Canada 26 years ago, fleeing persecution for resisting inequity and state violence in Guatemala. Currently, he is the organizer and outreach coordinator for the BC Federation of Labor's Occupational Health and Safety Center's Migrant Worker Program in Vancouver. He is also an active member of the Sanctuary Health Collective and Migrant Rights Network, a grassroots collective advocating universal access to healthcare, education, and social services for all. His passion to build a society rooted in equity, human rights, dignified working conditions, and high quality of life has led him to organize grassroots community efforts to ensure that essential needs of the people are met and services are provided. Our second participant is Kelly Go, who is a Chinese settler living on the unceded traditional and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. Kelly began volunteering with SWAN Vancouver in 2016 before stepping into a full-time outreach worker role in 2017. In the spring of 2019, she transitioned into her current outreach coordinator role and now oversees SWAN's outreach and netreach programs, outreach volunteers, and quarterly newsletter. And I think we have some students who might be volunteers, so who are working with you, so thank you for that. Our third participant is Lara Maestro, who is a UBC iSchool grad and a member of Migrante BC and Sulong UBC, a Filipinx youth and student group affiliated with Anagbayan Canada. She was a founding member of Migrante BC's Women's Organizing Committee, now Gabriela BC. While her day job involves records management and privacy protection for a women's anti-violence housing organization in the downtown east side, the majority of her time outside of paid work is dedicated to educating and organizing Filipinx youth and students to mobilize around issues in the Philippines by linking our passion as diasporic Filipinxes to the conditions and problems of our motherland. Our fourth participant is Lara Maestro, who is a community organizer and activist when she is not being a librarian at the Vancouver Public Library. She is also an archivist by training with degrees from Dalhousie University in Nova Scotia and UBC. Lara co-founded Migrante BC, the grassroots organization to protect and promote the rights and welfare of Filipino migrants and immigrants, where she does education, mobilizing, and organizing work. Lara was an activist under the Marcos dictatorship in the Philippines, and well aware that there is a new tyrant, Duterte, in the Philippines, whose policies affect overseas Filipinos and migrant workers. Our fifth participant is Dr. Anna Maria Richardson, who is a community-based pediatrician who works with children and families with medical, behavioral, and social complexity, as well as families living with impacts of racism. Dr. Richardson was born and grew up in South America and previously worked as a teacher. These became formative experiences that helped shape the critical lens with which she views the world. So this is not a standard talk, this is a roundtable dialogue. And it will begin here with a question from me, and we'll give time for each panelist to then talk. And then we will move to questions from our two moderators, Dr. Idang Trong and Dr. Pilar Riaño Alcala. And then we should have a good 10 to 15 minutes for audience Q&A. As we have only 1 hour here, we also invite everyone to stick around after 1 p.m. to continue our dialogue in a less formal, less formal atmosphere. So our first question, if each of our speakers could speak to, is to first just please introduce yourselves and the type of work that you do, a bit more expanded than I gave a bit time to, and discuss how your work and organization relates to the key terms in this event's title, which we came up with together. So I'm not trying to get you to talk about things that we just made up. But the title is Pacific Borderlands, Sanctuary, Health, and Precarious Migrants in British Columbia. And to make it easier, I think we'll go in order that I introduced you. So Byron, if you could go first. Oh, and you have to unmute yourself.
Yes, that's right. And hello, everyone. And thank you for this invitation and recognizing that we are currently doing this event in stolen lands for the First Nations. And yeah, I'm Byron Cruz. I work with the Health and Safety Center of the BC Federation of Labor, and I'm a member of the collective Sanctuary Health. And we work with migrant workers or migrant communities with precarious immigration status, including agricultural workers. Thank you.
And the next was Kelly. Kelly, go.
Yeah. Hi, everyone. My name is Kelly. I'm the outreach coordinator at SWAN. We operate independently from government, law enforcement, and other faith-based groups. We promote the rights and healthy frontline services and through frontline services and also systemic efficacy and yeah.
Okay, it sounds like we're just doing very short introductions for now, so maybe we can come back to that question about the keywords after we all just say hi. So the next one I had here was Lara Maestro.
Hi everyone. My name is Lara, as Chris said. If we're going to come back to it, I guess I'll shorten my intro and just say hi to everyone and say thank you to Chris for always including us as community members in these discussions, and to Idang and Pilar for moderating us today. I work with Migrante BC these days, usually mostly in my capacity as a member of Sulong UBC, which is a Filipinx student group. And I'm also Aries' daughter, which you might have surmised from the sharing of our last names. So you might hear me refer to her as Nanay, which means mother, throughout this panel. And just a little bit about Sulong is that we do have one of our pillars being integrating with our basic community issues through working with migrants and migrant workers. But I'll save a little bit more of our description for later on.
And Ari?
Okay, another round of short introductions. Yeah, so I am a librarian by day and by night if I have a work shift, but I am a community organizer and activist with the migrant community, and I have worked and know some of the people, most of the people here, and maybe in the participants list. So Migrante is an organization created in 2009. We are a grassroots organization running on membership and volunteer fuel, and we do work on organizing, education, and political campaigns. Yeah, I'm happy to be here. Thank you.
And Anna Maria?
Again, I want to echo appreciation for being invited here, and again, acknowledging the lands on which we live, work, and play that were not ours to begin with. I'm a community-based pediatrician. I'm in my clinic today. I work within my community practice as well as in the downtown east side. Through work in the downtown east side, I got introduced to the precarious population with work at Watari, because I think of my language, the fact that I can speak Spanish coming from South America. And I think I was shocked and surprised, maybe at my naive perspective on everything, that I didn't even know that there's an entire population out there in Canada that doesn't have access to equitable healthcare, only by virtue of where they have been born. And I feel like a lot of the work that I have done after becoming a pediatrician in the community is about advocacy and wanting to lend my voice to try to enact change. And I think this is where this initially started from so many years ago. So I'll leave it at that. And then I don't know if we're going to do another round to address the key terms, but happy to jump in wherever.
Well, let's do that. Why not? So why don't we start again with Byron, because I know Byron has a lot to say about this too. But can you talk about one or all of these terms or themes, Byron? Sanctuary, health, and precarious migrancy in British Columbia?
Excuse me, Chris, is this different from the formal question that we were going to go through the roundtable?
It is the formal question, yeah.
It is the formal question? Okay.
Yeah.
It's not about the migrant workers during COVID time? And
I think that will be one of the questions that Idang or Pilar will ask. Yeah.
Oh, okay. Okay. Sorry, can you repeat again the question? I'm just still sleeping.
The question is, how does your work and organization, if you could just introduce some of what you do, and how it might relate to themes of precarious migrancy, health, and sanctuary?
Yeah, thank you. As you know, the term sanctuary was actually a word that came from a lot of the experiences in the United States a few decades ago, especially came from religious leaders who were even accused of being human traffickers because the system didn't like the work that they were doing in terms of supporting refugees coming through the border between Mexico and United States. And then so many people were dying at the border. Then religious leaders decided to start helping them to cross the border and providing the legal support that they needed to request asylum in United States. And the root of the sanctuary movement comes from that time. Many of these religious leaders were incarcerated because the work that they were doing with migrant workers and with refugees. And slowly the idea of sanctuary came to Canada as well. And there was a movement in different cities about trying to declare sanctuary cities. Toronto, Sanctuary City, Montreal, Sanctuary City, Vancouver. At the end, we realized that those are not real sanctuary cities. These are access without fear cities, meaning that they have policies regarding access without fear, but not sanctuary policies. And then as a sanctuary health, we were born a few years ago in 2011 as a result of fighting back the elimination of the interim federal health for refugees. Later on, we started to work with also undocumented pregnant women who needed a safe space to have their babies, and also a place where they did not have to pay $15,000 to $75,000 for delivering a baby. Then our network was created. Later on, we created a collective. Currently, we work with still work with a lot of refugee claimants, also with moms with precarious immigration status who are pregnant, who have their babies. And we have been working together in terms of fighting for spaces, for sanctuary spaces in clinics, in hospitals, in schools. We have victories, we have successes, we have failures as well. But we're still here, and same as everyone else, fighting so hard I'm not a librarian, but I see her being a librarian day and night, but she's an activist day and night as well. And we work so hard. We are part of the Migrant Rights Network of Canada, where more than 50 groups are working together now. Thank you.
Thank you. And Kelly, do you want to tell us about SWAN?
Yeah, so I'm going to relate this question to the population that we support at SWAN. So like I mentioned before, we support immigrant and migrant women who are in the sex industry. And the population that we support are facing both the criminal law and also immigration prohibition on sex work. So selling sex is legal in Canada, but purchasing is not, and so is everything else surrounding the industry. Basically, it creates a really unsafe working environment for all sex workers. And on top of the criminal laws, the immigration prohibition on sex work prohibits anyone who is not a Canadian citizen from working in the sex industry, which in itself creates unsafe working environment, again, where migrant sex workers are vulnerable to exploitation because there is no security or safety net for the workers. And so sex work stigma on top of the prostitutional law in Canada, coupled with the immigration prohibition, created the context in which migrant sex workers cannot call the police when bad things happen because of the risk of investigation, detention, and deportation. And also, the people we support are really reluctant to access health, social, and other services. So on a systemic level, we are actively challenging a lot of the mainstream anti-trafficking discourse because these are the discourses that encourage law enforcement action that ultimately harm migrant workers, migrant sex workers. And a part of this is through the challenge, through challenging the assumptions and stereotypes that construct migrant sex workers as victims in need of saving. And this is also the logic behind the immigration prohibition on sex work. Essentially, racialized women who are in the sex industry are often portrayed as victim and assume that they need to be saved when they don't perform this victim identity, there is this risk of being identified as a criminal or a trafficker sometimes. And so when sex workers who are victims of crime, they can lose their victim status by not fitting into this expectation of being passive in need of saving, and essentially losing this victim status could mean investigation, detention, and deportation. And these are the really highly racialized and gendered narratives that increase physical violence against sex workers and render them disposable and deportable by the state. So, yeah.
Thank you. And Laura, I believe you're next. Lara?
Yeah, so I'm going to keep mine short because I know that my mom will give more information about the Filipino migrant community. But as with Kelly, I guess I'll refer the question to the community that my organization serves. So thinking about the Philippines as one of the largest exporters of human labor to the rest of the world, due mostly to the government positioning the labor export pipeline as a pathway out of the widespread poverty in the country, which is like a cause of our colonial and imperial history, being subject to imperialism by foreign nations, and that labor export pipeline has also allowed the government to sort of sidestep their responsibility to provide jobs, to provide industry, to provide social security or a safety net to any of its citizens, means that the Philippines is like one of the largest source countries for migrant labor to the rest of the world, and that includes Canada. So it means that the issues of our community here are fundamentally the issues of migrant workers and the issues of our home country. So as youth and students that are part of Sulong that work with Migrante BC, it's critical that we maintain these connections through working side by side with migrant serving organizations and other Filipino serving organizations. And it's actually the way that we can most intensely and materially connect our struggles to the struggles of people here, other diaspora communities, and also Indigenous struggles for sovereignty and for land. if we can really interrogate and address the issues that force the people in our home country to leave every day and then to thus settle and migrate to other people's Indigenous lands, then we can make a concrete contribution to stopping that continued settlement. So we really do connect everything that we're doing here to the things that that our people experience back home. And we maintain that the key to the health and well-being of our communities here is taking care of each other and taking care of ourselves in a way that allows us to connect or reconnect with our culture and our roots. So, but in a very meaningful and material way through concrete contributions to our community, not just things that remain on the surface level of like cultural appreciation. And that's how we relate to the theme of the panel today, is that the health and well-being of our communities is tied to the stakes of migration and to what is happening to all of our people back home.
And Ari?
Yeah, thanks, Lara. So the title is really appropriate, especially since we're still under the pandemic. As a member of Migrante, committed to protect and promote the rights and welfare of migrant workers and of immigrants, we see the pandemic as adding another layer of burden, adding another layer of challenge to the situation of our precarious migrant workers and our low or minimum wage, low income workers, members of our community. Pre-COVID, the members of our community, whether they're Migrante members or not, have come to us for help, for assistance in completing their forms, information, and referral, all work related, open work permits, LMIA, unfair conditions, and personal ones, like how do I get a divorce? Under COVID, these requests did not change. Instead, COVID added another layer on top of that, because then you have longer wait time, the bureaucratic hurdles, caregivers telling us they're literally not being allowed to go out of the house. With the single facility rule, our migrant workers, our care aides are being made to choose one facility, which means reduced work income, and also the fear that they may not be able to go to their other workplaces once COVID is over. We've heard from our members who are in non-unionized work sites that the PPE is not enough for all of them. So they have to be, there's a hierarchy of when and how you get your PPE. And they've also mentioned that the cleaning staff in their work sites make more money than the care aides. So we see and we hear the stories of low pay, increased workload, unfair work conditions, and they were there before COVID, but the gravity and the nature have indeed changed. So when we say that COVID-19 has, and we've always said this, has publicly exposed the unfairness, the inequalities and treatment of workers, all of us have known that. Those who are in the migrant worker organizing sectors, we have known that. But then it was the public exposure and the public expose that really made essential workers as visible workers. But that did not mean that they were disposable, that they were not disposable. So like what Lara said, Migrante takes the position that the migration of Filipinos is not a personal decision, but a societal and political phenomenon in the Philippines, because it is migration, it is the objective conditions in the Philippines of landlessness, poverty, unemployment, underemployment, lack of basic social services, displacement because of mining and because of militarization that pushes workers, men and women, 6,000 every day, to go out and look for jobs abroad. No one should be forced to migrate in the first place. And so I'll end it there. And so, and the sanctuary, the best sanctuary, and I know that Byron said it's only access to without fear. The sanctuary is in the organized strength of migrants and their organizations. Yeah, that's it.
And Anna Maria?
Yeah, I think I definitely have maybe a little bit of a different lens, considering I'm feel like I'm just a community provider. The big thing for me, the big shock to me, I feel incredibly naive. I have all of this privilege. I'm a physician. I used to be a teacher. You know, I've never experienced racism myself. I've gone to university. But at the same time, I have a history of having been born in and grown up in South America. And so I feel shocked in a way that I've gotten to the point that I'm at right now, and I did not know that there was an entire population of people living within Canada that don't have access, that are pushed to the margins by our, structural and systemic of barriers, that are pushed to be quiet because of fear of accessing support. I'm a pediatrician, so I work with children and their families. And to me, it just was unacceptable that families were unable to attend the emergency department when their kids were sick for fear of being, reported to immigration, which does happen, absolutely. I was shocked and upset, that children would come to me, and for a child that was Canadian or that had a more non-precarious situation, the 10 things I might order for them, I couldn't order for this child simply because they were, as Ari said, pushed away, displaced from their home. These are not families that are choosing to leave and choosing to be in Canada just because for fun, right? These families are needing to leave for multiple reasons. And I feel like as Canadians, we are on one level so proud of our system, so proud of our amazing healthcare system, but at the same time we're completely ignoring an entire population of people. That is not something I totally agree with. I'm upset and unhappy that throughout my education, throughout my medical degree, throughout my residency, I hadn't heard of the precarious migrant population. I feel that until we start changing our education and until we are teaching those that have enough privilege to have gone through medical school, that we need to start using this and trying to advocate for equitable access to healthcare for everybody, like nothing's going to change. Right now, I'm very much downstream, I think, from everybody here, and that I'm just kind of working on an individual basis. And I feel like a lot of the support I'm providing to families is almost like a barter system with a community of people that I know are going to be able to provide me with support. I have an eye doctor I can call, and she will see patients off the record. I have a, audiology, but that's not the way the system should work. The other question I keep asking myself is, what about the other communities that, that I don't have access to because I'm only exposed to the Latin, the Spanish speaking community, and that's probably even the tip, a very small proportion of the Spanish speaking community. I feel like we as Canadians need to push for equitable access to everybody. It's the rights of the child is a Geneva World Health Organization initiative, and it shouldn't be barrier upon barrier upon barrier that's given to families. And then the burden gets placed on the family. The burden gets placed on the parents in order to navigate a system that they're unfamiliar with. They may not have the language, living in fear, navigating a system where they are constantly questioning if this is going to be the time that they're going to be reported, and this is going to be the time they're going to have to leave where they're at right now. That's me.
I'm going to hand the mic over to Idang and Pilar, who are going to run the moderated Q&A.
Thanks, Chris, and thank you all for your comments just now. I found them very illuminating, and I also wanted just to say thank you for all the work that you do. It's really an honor to be gathered here with you and to be able to learn from you today. Just just wanted to highlight three things that really struck me as you were all speaking. First was Byron's comment about how cities in Canada are often celebrated as sanctuary cities in name, but not in practice, and as in the case of Vancouver. And Kelly, just your comment about how migrant sex workers in Vancouver are rendered into deportable populations, and they sacrifice sort of their personal safety and their fear of being deported, and as a result are denied healthcare. And also, Lara, your comments about how the Philippines provides the most exported labor to the world, including to Canada, but how this is not acknowledged within the system. So my question is just to follow up on Ari's comment is, in your various roles as practitioners and organizers, how has the pandemic or other crises of the past year impacted the various communities that you work with, and how have you had to adjust to the new situation? So maybe I could just turn it over to Byron first.
Thank you. And yeah, it is, yeah, it might be taking a long, but I know that we have 5 minutes. Okay, and in this situation last year, when the pandemic started, we knew that it was going to be a challenge for everyone to respond. And Canada was not ready, no country was ready, no system was ready for it. And last year, we knew that all the situations that we were trying to bring to the surface since a long time ago in terms of precarious housing at the farms, the labor rights violation at the farms, and all of these abuses going on in the agricultural system. This situation was there, and the pandemic brought it a little bit more to the knowledge to people what was going on. And as we were anticipating, lots of farm workers were going to be affected, and that happened. Last year, we had around 1,000 and a little bit more than 1,500 agricultural workers who were infected with COVID, affected with COVID in the area of Ontario. And 3 migrant workers died as a result of COVID in Ontario. In British Columbia, the situation was a little bit different in terms of how we were dealing with the situation, and something good, we had to say something good sometimes. Over here, in terms of the dealing with the pandemic and the quarantine for the agricultural migrant workers, British Columbia was, I think, the only government who decided to pay for the quarantine in the hotels in Richmond for the migrant workers. That made a little bit of a difference, a lot of a difference actually, in terms of reducing the exposure to COVID at the beginning, and that gave a little bit more time to also provide information and also discuss the rights with the workers. And as a result of that, in British Columbia, the number was maybe 100 infections in the agricultural migrant communities last year, compared to 1,500 in Ontario. And it was well done. The healthcare system was ready to provide the services at the hotels in Richmond. And of course, we had the same situation in the farms as previous years: precarious housing, violations of the labor rights. The COVID protocols were used by the farm owners to reduce the possibility of the workers to go for help. They couldn't go for help, and we couldn't visit the farms. If the migrant workers organizations went to the farm, we were going to expose the workers to be blamed by the owner. And as a result of that, there were some repatriations actually in Kelowna of workers that received the visit of a grassroots organization at the farm, and they were repatriated in next day, right, without rights to say, well, we needed food, we needed clothing. And then it was challenged. We had to respond with food, we had to respond with clothing. We had to be creative, had to bring this to the workers, and without putting them at risk, right? And the same thing happened at the end of the year, last year in the Fraser Valley, workers getting sick, being afraid of going to look for help. We know that migrant agricultural workers come with a tight working permit that doesn't allow them to work for different employers, only with one. And then they are afraid if they say something, then they are not coming next year. They are not coming for the next season. Then we had a really bad situation on the farm at the end of the year. A few farms were declared actually with outbreaks, but the health authorities didn't know about that. We had to support the workers in connecting them with the health authorities, and finally massive testing was done in the farms, and all the farms that we told the Fraser Health, all the farms have outbreaks, and massive testing was done. In terms of the situation with the undocumented workers, the families that we work with are also very difficult situation. Last year during actually at the beginning of the quarantine, so many people lost their jobs, and of course, not having a social insurance number, not having a status, an immigration status, it's really hard. People are not able to get any of the federal support, any of the provincial support. Then some people were in a real immediate situation with losing, they couldn't pay the rent, and they didn't have food. And then we were working with the Filipino organizations also to support some of Filipino families as well in the same situation. And fortunately, we were able to get solidarity support from different people, and we were able to support with food, and in coordination with Watari, non-for-profit organizations, we were able to also get some grants to support people with their immediate housing situation. And at least people who are part of our network, no one had to go to the streets, but I'm sure that there's so many people that probably have emergencies that we didn't know. Then later on, there was the initiative from the community network that we work with, and we came with our own organization of the food security for the families, and 150 families are still getting week-to-week support from us. We do have a system where families connect with us when someone gets COVID. We did our own community research. In November, 20% of our members were affected by COVID. Right now, I would say probably 40, 50% of our members affected by COVID with no access to immediate healthcare, fearful of accessing healthcare. And we have to work with actually only one clinic that allowed us to, we call them and we say, we have this situation, this family doesn't have an MSP, they need COVID testing because they were exposed to it or they feel symptoms. Then they are received later on at night, and that's the only clinic that we have available for testing. The other clinics are available, but there is presence of the Vancouver Police Department in those places, like the testing site at the Vancouver Community College, for example. Then that makes the situation hard, but we don't stop. We were working so hard with the other migrant workers organizations and the Migrant Rights Network. We also were advocating for vaccines for all, and then we are advocating for access to vaccine in a dignified manner and in a way that people should not be asked for their immigration status, should not be asked for MSP. And that is, I had the first result a few weeks ago. British Columbia also was the first place to authorize the vaccination of agricultural migrant workers. Everyone at the quarantine is getting access to the vaccinations right now, but that was a result of all these campaigns that we have been working on. And also the workers are getting vaccinated in the farms. And that is only happening in British Columbia right now. Ontario is going to start soon, but it's taking more time. And also in terms of workers with precarious immigration status or no status, getting the vaccine is still hard, but we are working with Watari and the health authorities in order to start doing some clinics. And still, we don't have any public statement from the province of from the provincial government stating publicly in written paper that they won't share information with Canada Border Service Agency. We are afraid that this information, where your name and everything after putting the vaccine on your arm, we don't know where that information goes. We need a more clear statement. We have some initial public statement, but not written. We would like to see a more like a policy in terms of not sharing that information with Canada Borders. And we will keep people updated about this. And thank you for this opportunity.
Thank you, Byron. Anna Maria, I know you've worked with Byron at Watari providing healthcare for undocumented children. Could you maybe talk a little bit about how the pandemic has impacted you as a pediatrician?
Yeah, I'll be really brief. I think Byron covered a whole bunch. So my work through Watari, and I think it's the way that we are generally able to access communities that are pushed to the margins by our government and by our current structure, is through community partnerships that have already brokered trust with this marginalized community, right? With the pandemic, I have all of that, I used to attend Watari at a, ad hoc, once a month, Friday evening, family gathering. And so I would see kids as they came along. All of that got shut down. So the questions I have are, where are those kids now? Who are they talking to? What has happened to them? And I feel like it's a huge, huge issue that needs to be addressed. I think also, just commenting on what Byron said, I feel like our healthcare system puts on blinders and says, we're only going to be vaccinating Canadian citizens and we're going to ignore everybody else. But this is a public health issue. This impacts everybody. It's a global pandemic. Like, how can we have such a narrow approach to a global problem? I'm talking about the pandemic. And so it's really incredibly frustrating to me. And then last point is, like, I feel like me and my colleagues, the physicians, need to stand up and advocate as a group, because we're a powerful group of people. And I feel like if we garnered enough support and if we garnered enough voices together, we could together advocate for change. And so that would be like my hope. But going back to the pandemic question, the COVID, where are the kids now? Who are they seeing? I occasionally get an email from a family asking for a specific question, but that's not how we're going to be supporting everybody.
Thank you, Anna Maria. I'll just pass it over to Pilar now. I think we've just decided to kind of divide up the questions so that Pilar can address the rest of the panelists.
Thank you, Dan. And thank you, everyone. I think it is, let me acknowledge and celebrate having each one of you here. And what I would say, it is this opportunity to have an encounter between the activist, community-based, professional, and long-term type of knowledge that you bring, and to have it within the context as well of, an exchange with academics. I think I do celebrate that and celebrate that possibility. And as well, like what as in listening to you as well, like what this kind of raised in terms of all the, not only the encounters, but as well the connections, as to say, with the title of Pacific Borderlands, and how you have highlighted, like when we think about those issues of human labor, migration, precariousness, we cannot disconnect it from issues, of land issues and dispossession elsewhere in the Pacific or in other regions, in the same way that we cannot disconnect it from issues of violence at the border in many, many borders that we can see. So thank you for that. And I think talking about encounters and continuities, there might be as well some disencounters here. And let me now, take advantage of thinking about the relationship between this critical and changing landscape that you have just described, and the type of academic engagements that you have had with researchers over time and academics. And the question is, I'm going to ask you to reflect upon those interactions with researchers and academics and the relevance or not of such engagements, and in what way they may or may not be relevant to this context that you have described. So I'm going to address these questions to Eri, Lara, and Kelly. And I'm going to begin with Kelly. I know, Chris mentioned you have quite a few, there are students working with SWAN, and there is, a number of different interactions. And I know Migrante has had lots of interactions with researchers. So let's hear from you in terms of some of the reflections in that regard.
Yeah, SWAN has actually been very selective when it comes to working with researchers. We're always cognizant of like the power imbalance within academia with community organizations, particularly when it comes to research on marginalized people. So the latest, like one of the latest researches that we were a part of was about gender migration, and that was with an international organization called Global Alliance Against Trafficking Women. And this organization takes a really critical perspective on trafficking and also emphasize on labor rights and human rights of migrants. So I guess this is just an example of like a research that we agreed to be a part of, because basically it was made possible because one of our board members, she is a professor in a university, and she's also agreed to be the person who is going to be analyzing the data and overseeing the entire research process. So we feel really safe, and also that also ensure that the voices of the people that we're going to be interviewing are represented properly and ethically. And we also want to ensure that the researches that we're doing are meaningful and can help to bring about change that will benefit the people that we serve. So this particular research helped SWAN to understand what the woman needs in terms of working in Canada, and also it assists us to develop job skills sessions, and also to engage in advocacy with the women that we serve. And another thing is we also always ensure that there are money where we can use as honorarium to give back to the participants, and also just to give have a process of ensuring that all of the findings are like clearly explained to the participants. So right now we're also in the process of creating an info sheet where all the findings and the next steps from SWAN, like what are the next steps going to be to give back to the participants. And we are also very aware of the language barriers, so we will also make sure that it's language specific. I think finally I would just add, like right now we're not really looking to conduct more research, because internally we're trying to do more like community-based research and consultation that's going to be carried out by the woman that we support. So we're also starting a peer programs. We're also training peers to conduct interviews. We auto when it comes to consultation and research. Yeah.
Thank you, Kelly. I think we lost you a little bit. The last part that you said, we didn't hear it complete. Do you mind just repeating it? Because
yeah, I was just saying right now SWAN is focusing more on a community-based model of not really research, but more like consultation, where it's going to be carried out by the women themselves. And we're also doing training with peers in terms of how to conduct interviews. And also they are going to be the one who decide what we're going to research or what the consultations are going to be. So that's something that we'll be putting our time and resources in. Yeah.
Thank you, Kelly. You gave us a lot of very interesting ideas, and I'm sure that Eri and Lara can relate to this and take it as well in your own reflections about this.
Yeah. So Lara, do you want me to start? Okay, so overall, Migrante BC was launched in 2009. And with regards to interactions with researchers and the relevance of engagements, overall, our interactions and engagements have been respectful. They've been collaborative, dutifully acknowledged in scholarly research. And I think the key word here is both parties practicing the community-led approach to working together. Other people may call it participative action research, but essentially it's both groups working together. And when we say engagements, it doesn't only have to be with faculty. Our experience has been with faculty, students, both graduate and undergraduate, and they could be migrante working with a student group. So it's all across the board. With even without scholarship, academic engagements like this one, being in settings like this one, has, and in classrooms, outside the classroom, I think overall Migrante believes it's contributing to a greater understanding of migrant workers in general for the Filipino community, would be specifically caregiver issues, and also looking at and understanding the history of Filipino diaspora in Canada. When we've been asked to be as guest lecturers in the university classrooms, we've always jumped on that because it's part of our educational work. So in the classrooms of Chris Patterson, with Becky Ross, with Nora Angeles, or doing projects with Jerry Pratt, this has really helped, I think, both parties. There are many opportunities for working together, and one of the nicest and unexpected, and Lara will maybe talk about that at length, is the guest lecture presentation we did in Chris Patterson's class has actually resulted in the Student Undergraduate Society, the BIPOC, the Black Indigenous People of Color working group, and Migrante to come together to develop something that we would not have done because we don't have the time, we don't have the capacity to do so, a podcast project. So it's Kwentong Migrante, or migrant stories, and it's really helping together and working together, and we really like that. We have, when Migrante was launched in 2009, the very first project we had was with UBC, and essentially it started the track record of Migrante as an organization who can deliver projects, who can use money wisely. And the other one was a project, and I need to mention this, it was a project on diversity, art, and the diaspora. And the settings and the venues were in UBC. And this was the first time that Migrante members, almost majority of them and the public, had to go to UBC. And when we asked them how they felt, they said, this is the first time that we've ever been inside the campus. These are people living in Vancouver, has never stepped foot inside the UBC campus. And this was for me, it was an eye-opener, because now when they mention UBC, it's not a blur, it's not a picture on a catalog, but it's a visual image of I was there, I was physically there. This is probably the school where I can send my children to. Of course, the tuition is very high, but anyway, there's the connection between the community and the university, and bringing them together. So all of this has actually expanded, it's strengthened our engagement, our network, our lobbying advocacy efforts. And I want to note that this is not dole outs or charity, but a real practice in solidarity, in allyship, and working together. And it doesn't have to be a big thing, meaningful interactions, like when Sulong and the other youth participated in our mutual aid network to fight COVID. It's called Kapit Bisig, which in English means linking arms to combat COVID. It was basically the youth teaching us what was an Airtable. How do we use an Airtable? Well, nobody knew what was an Airtable, but helping Migrante set up its first Instagram account, things like this. So overall, these are important. When done correctly, when done with respect and collaboratively, it is a win-win for both parties. I think the work of Migrante with the academic community is an extension of the way we work with other migrant organizations in our community, which is out of respect, mutual collaboration, like with Byron's group, Sanctuary Health. So in that sense, it has been very helpful to Migrante.
Can I just jump in here, Ari? Thank you so much for that. But I know some folks in the audience have to leave at 1 o'clock.
Oh, sorry.
No, that's fine. But so I think we're going to have a pretend goodbye and maybe turn off the recording, but we invite people to stay for the discussion. JP, I don't know if you wanted to say more. JP, by the way, has run this whole series for the past year, has done incredible work, and has been working very hard on it. So thanks to you all for speaking, and thanks to JP for that. JP, did you want to say anything?
No, nothing from my end. I just want to, thank the panel and to Yidang and Pilar and you for organizing, and well, all of you for organizing. Really, it sounds like amazing collaborative work too, to kind of conceptualize what kind of conversation you want to have. So yeah, that's it from me.